At S.H.Tang Heart and Arrhythmia Center, we provide consultation for various kinds of symptoms like chest pain, breathlessness, palpitation, giddiness, coughing with sputums, swellings of ankle. These are the symptoms that points to the possibility of heart disease. My approach in consultation is, number one, to speak the language of the patient, rather than requesting the patient to speak my language. That's why I'm well versed in English, Bahasa Indonesia, Bahasa Malaysia, 普通话，还有各种的方言, so the patients can freely express their symptoms and their problems to me. Second, my consultation, I like to use diagram to explain to the patient, for example in this case, how the electrical activities of the heart get conducted in the heart. And very often patients come to see me with the problems of artery blockage on the heart. I like to use the model to explain to them the artery of the heart, how blockage can cause problem. Thirdly, I always end the consultation with conclusion, writing down the essential points on a piece of paper so the patient can have a clear takeaway messages. They understand what has been explained, what are the implications of the consultation. At this center, we also provide echocardiogram service. An echocardiogram is an ultrasound machine dedicated to scan the images of the heart. Most of the patients who require this service because they complain breathlessness, or on the chest X-ray show that the heart shadow is enlarged. What is important about ultrasound scan is we look at the structure of the heart, whether the heart is enlarged, the valve, whether the contraction of the muscles are strong or weak. We also do what we call color Doppler. It helps to see the blood flow through the valve. It can also diagnose the possibility whether there is a hole in the heart. In addition to the color Doppler, we also do what we call pulse wave. We want to see the blood flow, the speed of the blood flow across the heart valve. By doing all these tests, we can comprehensively evaluate the heart function. And very often, I do the scan myself. And during the scan, I can talk to the patient, I can explain to the patient. For example, in this case, Mr. Kaur, looking at your scan, your heart function is very strong. I'm happy to see that I have not found anything wrong with your heart. It is my routine practice that after performing an echocardiogram, I take time to explain to the patient. For example, in this case, Mr. Kaur, this is your heart. This is your valve that's able to open and close. I can freeze the picture and I can do a playback where the valve closes tightly and I can see whether the valve can open widely or not, which is normal in this case. You can see the heart muscles here contracting, meaning that the heart muscles are healthy. And I also go through each of the recorder loops with the patient. In this case, we are looking at the color flow, looking at the blood flow going through the valve. Then we often stop the heart and we do some measurement to see whether there is an enlargement of the heart. So we do what we call some calculation to see the thickness of the heart muscles and the dimension of the heart muscles here. If there is any problems, I will take extra time to explain to the patient what the problem means and what are the treatment required.